Hi, this is Stace Lind, and we're going to talk tonight about ricin. It's chemical poison, uh, discovered in 1888, one of the most toxic substances known. And we're going to look at some of the special concerns. When we look at accidental exposure to ricin, it's rare. Ingestion is usually from the seeds or pods. The three ways that is at risk most commonly today: bioterrorism agent developed by countries. Why is it? It's one of the most lethal in enclosed environments, subways, buses, or supermarkets. Why do they use it? Why? It's cheap. The plants are everywhere, all over the world. People are making castor oil, and the plants are available. The seeds are available, and there's many directions on the internet to teach people how to make this poison. Very poisonous, and it leads to a high death rate. Laboratory and research through nanotechnology and anti-cancer agents, it's being designed to kill cancer cells. Great use for it. Ricin is used throughout the world to make castor oil. As I mentioned, waste or mash has 5 to 10% ricin in it. The key with this is ricin is stable under normal conditions, but can be inactivated through heat above 80 degrees centigrade or 176 degrees Fahrenheit. Then it's fed to cows and animals. How can someone be exposed to ricin? Through inhalation, ingestion, direct injection, skin and eye exposure. Inhalation, bringing them in purified form within a few hours. Symptoms of respiratory distress, difficulty breathing, fever, cough, nausea, tightness in the chest. Ingestion, eating seed or extract, within hours, vomiting and diarrhea, blood in the urine, and danger to the organs. Direct injection, the most deadly. Death can take place within 36 to 72 hours. Skin and eye exposure, although unlikely, it will cause redness and pain, usually will be survived. It comes in through endocytosis to the endoplasmic reticulum and Golgi bodies, and then out through exocytosis. And this effective inactivation of ribosomes is where it prevents proteins and leads proteins from being made and leads to cellular death. And 5 to 10 micrograms per kilogram can be lethal. Ricin is a chemical poison. The illness cannot be spread from person to person. There is no antidote. No antidote exists. Most important factor, avoid exposure in the first place. If exposure cannot be avoided, the most important factor then is getting the ricin off or out of your body as quickly as possible. Fresh air, leaving the area. If exposed, remove clothing. Cut the clothing off so you don't pull it over the face and eyes and mouth and nose. Getting medical care. What's the medical care look like? Treatment is supportive medical care, helping victims breathe, giving the patient IV fluids, medications to treat conditions, seizures, low blood pressure, flushing their stomachs with activated charcoal. The ricin is contained in seeds of the castor bean plant. How do authorities confirm cases? We look at toxicology. It's not very practical through the blood and urine test. It takes too long. The first epidemiological red flag of a suspected inhalation, the presentation of a large number of people who have been close to each other, rapidly developing the symptoms, flu-like symptoms. There's other pathology, but fever, cough, and excess fluid in the lungs by a large group in a close proximity. Suspected ingestion, if less than an hour, gastric lavage. Certain locations, U.S. and government and postal service offices use sensors to test and treat traces for threatening agents such as ricin. The substance is then referred to the Laboratory Response Network and onto the CDC for further testing. We look and we contact the state public health laboratory. Other contacts, regional poison control centers if suspected, Center for Disease Control. The takeaway, how do we protect ourselves? There's no antidote. Ricin poison can be fatal even with treatment. Treatment options prevent ricin from entering the bloodstream or flushing the eyes. Oral treatment with activated charcoal, IV fluids. Thank you so much for listening to this. I appreciate it. And